on how all cancers are treated differently. And can we talk about the ingestion methods, but also what you're hearing for rectal cancer, vaginal cancer, penile cancer, and what a lot of patients are reading and doing with suppositories?
Right. Okay. Well, it turns out that at least cannabis oil, in the way that it's generally prepared, is just not absorbed rectally. And there were a number of tests that were done both at University of Mississippi, and we did it in Santa Monica, where we gave a handful of patients suppositories that had, I think, about 350 milligrams of THC each. And then we drew their blood and measured their levels at 1 hour, 2 hours, 3 hours, and it was zero. I mean, zero. And we couldn't give that dose to them orally because that'd be way too dangerous. I mean, but it doesn't work. And now there's a form of THC called, and people are making a big deal of it, but I'm not that impressed. That just means, and this is a patent by Dr. El Soleil, and I don't mean anything negative in his name. If you take THC and you add this molecule hemisuccinate, then it does get a pretty decent absorption. But you can't just take acetate, mix it with THC oil, and you're going to have it. We're working on a different way, which is similar to the transdermal treatment for neuropathy, where there are excipients that will help vaginal absorption, rectal absorption, and mixing them in. And we finally did one, so we couldn't, because of Ramadan, if you can believe it. Because of Ramadan, we couldn't get the testing done at University of Mississippi because Dr. El Soleil is Egyptian. And last year, we're doing some blood tests, and he sends me a note that is one of the funniest notes I've ever gotten in my life. He says, Dr. Allen, you're an Egyptian thing. It was a phone. Dr. Allen, I'm so sorry I didn't get back to you. I was at Ramadan. And I said, you know what? I hear that all the time as an excuse. Anyway, he's awesome. And he's willing, when we started drawing blood and sending it to him in the University of Mississippi, I didn't have any issues with that. It's legal to send blood, even if it has cannabinoids in it. It's legal. But then he said, it would be great if we could get the oils that the people. I said, so you want me to send cannabis oil to the University of Mississippi, the National Institute of Drug Abuse? And I mean, I remember this conversation so well. He said, yeah, Alan, you think I'm trying to capture you? And I said, okay, fine. So we started sending him the oils. And we had a little, by the way, in case somebody's listening to this that would like to donate to a very good project, we need to, with all these products, we need to figure out how to get a lab going that will test them properly. And we'll test a final product. I mean, if this were a bottle right here, an invisible bottle, and you knew precisely what terpenes, flavonoids, waxes, everything are in it, and what concentration, and like limonene, X nanograms per ml, we'll know what that is. When I was talking to Dr. Raber, to me, it's unbelievable. It's unbelievable that we've been doing testing for 9.5 years, and we still can't test the final product. So the best anybody can do is to measure the original oil and then follow the dilutions. But we don't know if it's right. And to me, until we can measure terpenes and flavonoids in the final product, anybody that says what terpene is based upon what's in the weed is what's in, cannabis, it doesn't work. So we're going to do this after Ramadan.
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at UPatients Group and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.